According to the CDC director in the US, it's just shocking the number of pregnant people who died specifically in August last year, 1 month after the Delta variant became the predominant variant in the US then. And now that the Omicron is fast spreading, she says she's even more worried for the unvaccinated and pregnant. But what is the current status in Nigeria? Joining us in the studio here in Lagos is Dr. Gregory Ohihoy. He's an obstetrician, gynecologist, and a chief research fellow with the Nigerian Institute of Medical Research, NIMA. Thank you for joining us on the program.
My pleasure, Millicent.
All right. So yes, the National Primary Healthcare Development Agency said pregnant women, lactating mothers can take the vaccine, the COVID-19 vaccine. Is that still taking place?
Yes, and then that's the recommendation worldwide. The CDC in Atlanta, that's the US CDC, has very clear recommendations on the use of COVID-19 vaccine in pregnancy. Like the data you are actually quoted, noted that, the mortality from COVID-19 for pregnant women was quite disturbing, particularly in the early stages of the pandemic. And with the vaccine now known to be safe, at least from the current available data, it makes sense that our pregnant women should have this vaccine. They should be encouraged to have the vaccine, irrespective of the stage of the pregnancy, first trimester, second trimester, third trimester, puerperium, when they are breastfeeding. It's safe for them to have this vaccine.
Well, the question now is, are pregnant women in Nigeria really taking the vaccine? Is there any data to show the number that have received?
I think the real problem is that the communication, the messaging is not correct. I think we have to target pregnant women and let them know that it's safe for them to take this vaccine. We should incorporate this into our antenatal care program in many of our public settings. It should be a part of the antenatal care program. We should come out with practical strategic programs to encourage the pregnant women to take the vaccine. Just like we encourage them to take their tetanus tozoid immunization during pregnancy, we should make it a part of the health talk we give to them. You see, the challenge I have is that if you don't come up with a strategic program to solve a problem, you won't get the answers that you desire. We can't wish it and hope that the pregnant women will just take the vaccine. But if we encourage them, we incorporate it into our current antenatal structure, particularly in public hospital settings. We develop jingles, deliberate public health effort to raise the awareness, we'll be able to raise, vaccination rate among pregnant women.
We'll come back to some of the beliefs and perhaps myths concerning vaccinating pregnant women. But pregnancy, is it one of the underlying medical conditions that makes COVID-19 more susceptible to attacking them?
Not necessarily. I mean, the evidence we have so far doesn't show that pregnant women are more susceptible to COVID-19, as per a special group that is more susceptible, no. And we know that generally with pregnancy, there's relative drop in the immunity level. And anything that can drop your immunity level will make COVID-19 more aggressive. Remember that you're also dealing with two situations. You are also increasing the risk of the unborn child of having COVID-19. And the evidence is not so clear whether there's transplacental transmission of COVID-19 to the baby. It's still out there in the jury. And some data says there's transplacental transmission, so data doesn't support it. But what we know, which is more important, is that the vaccines are safe and they are effective. And we should encourage the pregnant women to take the vaccine.
So how much of that do people really know? Because there are fears about essentially it being associated with preterm delivery, underweight in the newborn. I mean, is there any study that shows that these vaccines are actually safe? And also, at the back end is those who are, rendering these services, antenatal care, are they really sending the message? Or, because I know some health workers who actually don't believe in the vaccines to start with.
Exactly, Abi. I think the last point you made really describes the situation we have. People have to, the health workers themselves have to have that conviction before they can even convince the pregnant women. There's enough data. Like I was just reflecting before I came to the studio. COVID-19 is no longer new to us, relatively. This is the fourth year, Millicent, it's the fourth year. It's 2019, 2020,
December
2021, 2022. So this is the fourth year we are dealing with COVID-19. There's some things we now know. I mean, we could have feigned ignorance, in the beginning and say we don't know many things. We now know there's enough data available in literature, available for those who are interested to show that, the vaccine is safe in pregnancy and people should be encouraged to take it. Of course, there will be myths. we were not aware from the current data that it decreases the risk of preterm delivery. It's not associated with any known congenital complication. Congenital, I mean complications or birth defects that you have when people have their babies. Well, there's no data to show that as of this moment. But we know that it can cause deleterious, negative effects on mother and baby. We know that. So let's work with what we know. We know that the vaccines are safe. We know that COVID-19 can run a very aggressive course among pregnant women in some cases. And we know that there's a vaccine that can reduce the risk of severe infection. Note that it's not as if the vaccine will prevent them from having, COVID-19 infection, but we know that at least it will prevent the risk of having severe infection and mortality in these women.
My final question is, very briefly, the Omicron variant, does it bring any added risk to the mix?
No. I mean, for what we know from the Omicron variant so far, the data we have shows that it's not as aggressive as the Delta variant, which is good. But remember also that the Omicron variant spreads very rapidly. So what we may have gained from the lack of aggressiveness of the Omicron variant, we may also lose in the sheer number of people who will get infected. Because if you have so many people getting infected, you are going to have so many people needing admission. You're going to have so many people that will overwhelm the health system. You're going to distract health workers from focusing on other aspects of healthcare. So I really think that really Omicron is not so special in terms of severity, but special in terms of its ability to transmit to people at a very rapid rate.
We appreciate your time. Thank you, and your knowledge on this issue. Thank you so much. Dr. Gregory Ohihong is an obstetrician, gynecologist, and chief research fellow with NIMA. Thank you for joining us.
You're welcome. My pleasure.